I would like to start, it's my great honor and pleasure to welcome you on the 11th International Conference Complex Treatment of Plasma Cell Dyscrasias in 2023 in Royal Krakow. This conference is very special because you know that it's some sort of Krakow tradition that we have 11 conferences at the moment. For example, Jorge Castillo, who is third time in Krakow, told me that it was starting a couple of years ago and it was a small conference, and now we have a conference focusing people from 9 countries, international countries. We have people from Serbia, from Chile. Thank you for coming to Royal Krakow. We have people from Czech Republic, from Germany, from United States, from United Kingdom, and others. Welcome also our colleagues from other centers like Szczecin, Wrocław, Lublin. Welcome our rector, Professor Tomasz Grodzicki, and welcome our former chief of the clinic in Krakow, Professor Aleksander Skotnicki. We live in very exciting time because we are like myeloma family here, because last 20 years exactly, it was established 19 drugs in one disease. It's incredible, absolutely. And last 3 years, it's very fast because we are in the era of immunotherapy. Exactly last month, it was established 2 BiTEs, bispecific antibodies, elranatamab and talquetamab. Previous year, it was teclistamab. So at the moment, we are on the shelf 3 BiTEs. We have also CAR T cells like Abecma, Carvykti, and others. I know that we'll have a lecture from Polina Stepinski from Israel about new facilities in this area. So we are moving very fast, and I'm sure that multiple myeloma and amyloidosis and plasma cell dyscrasia one day will be cured. I am focusing on this disease last more than 20 years, and to be honest, so big challenge and so big fast, it's first time in my life at the moment that in 1 month we established what was registered 2 new drugs. I tell one more time, elranatamab and talquetamab. And another we are waiting for. So Krakow is a very special place, and our clinic also is in special time because, to be honest, exactly in 5 days. In 5 days, we'll be in new building and new facilities. And you saw the name of this conference, Complex Treatment of Plasma Cell Dyscrasias Patients. Patient is waiting for complex treatment because multiple myeloma is a special disease. We are hematologists. We treat these patients every day, but we need cooperation with neurosurgeons, with orthopedics, with rehabilitation, etc. And in new place, in a new hospital, this is the biggest hospital in Poland, we are moving, and I hope our patients will find better facilities and better place for treatment. Welcome in Krakow, and I would like to ask our rector, Professor Tomasz Grodzicki, to tell 2 words. Yes.
Ladies and gentlemen, it's my great pleasure to welcome all of you here in Krakow. It's 11th conference, but as you probably know, the whole history of the university is more than 650 years, so there are a lot of conferences we can predict that you will organize on dyscrasias and multiple myeloma. First of all, let me thank all of you that you accepted the invitation of our host, Professor Jurczyszyn. Secondly, I would like to thank Professor Jurczyszyn for devoting his time to organize this conference and to also spend a lot of time preparing it. And I'm sure that although you didn't mention geriatricians in the team who is involved in treatment or care of patients with multiple myeloma. Me as an internal medicine and geriatrician, I would like to say that we are also involved, and we are very happy that hematology is moving to the new hospital, and we'll have an opportunity, unique opportunity to treat, not only to consult by phone or to send our patient to hematology, but we'll have an opportunity to cooperate very closely. It seems for me very important that after Professor Grodzicki much better remember than me, but for the last 50 years, we tried to move hospital to a new place, to build new hospital. And finally, 3 years ago, just before COVID, we opened the new building. Unfortunately, hematology couldn't move with us at that time, but now, next week, they are moving, and I'm sure that the next conference will be organized not here, or maybe not here, but in the new hospital, new place. So you will have an opportunity to visit not only museum, not only Pieskowa Skała Castle. I hope that you have very nice evening yesterday with concert and dinner, but also you have an opportunity to see our hospital. So I'd like to wish you a very good stay in Krakow. I hope that this is not for those who are the first time, I hope this is not the last one, but for those who are the second, third or fourth, I hope that next year you will come also to Krakow, and if only Professor Jurczyszyn will organize such conference, 12th one, or you hope so also, so I hope that you will accept our invitation and we will have very nice time here in Krakow. So have a good meeting, good stay, and I hope that you enjoy our not only buildings, museums, but also the fruitful discussion.
Thank you. I would like to add 2 words. Everybody has this book. This is very special because the picture was done, to be honest, by me. I was on the Tower Jesuits church. It's 76 meters, and I took this picture because to commemorate this old building. This is on Copernicus Street. First wing is hematology clinic. In the middle is endocrinology. It was in the past, of course, and another is cardiology. So this is a history. This is a history, and I love history. And we should remember that in Krakow, hematology starts. It was here in this area in 1949. Polish Hematology Association was established by Professor Tadeusz Tempka and Professor Julian Aleksandrowicz. Here in this town, in May 1950, was first Congress for Polish hematologists was done. Another Congress will be 31st in Katowice in 2 weeks. So hematology was born in Krakow. I'm very happy that I could continue this tradition. So I wish you a nice stay in Krakow, nice stay in this historical place. And besides science, I wish you to visit many places in Krakow. It's a lot. Thank you.